So let's start with a simple truth. Recovery doesn't happen in isolation. It happens in relationship with others, with self, and with support that's consistent, structured, and real. And that's why group therapy matters. In both intensive outpatient IOP or outpatient OP settings, group therapy is one of the most powerful tools that we have. It's time efficient, cost effective, and when done well, it gives clients a space to practice the very skills that help them stay sober in the real world. Now, here's the problem. Not all group therapy is actually therapeutic. Sometimes it turns into a vending circle, or it feels random or unstructured. Or worse, clients walk away feeling like they've learned nothing and connected with no one. Or they might notice that one therapist does things a certain way and another therapist is focusing on completely different topics. The goal of this training is to make sure that we're all working from the same space and we're all covering the same topics while retaining your it factor. What makes you you? What makes you a great therapist? What's your special sauce in group? We want to keep that. We just want to make sure we're hitting the same topics in group process. So that's where the matrix model comes in. The matrix model was originally created to treat stimulant use, specifically methamphetamine and cocaine, but its structure, pacing, and content have all made it useful for a range of substance use disorders. What makes it unique is the way it combines education, skill building, motivation, and accountability all inside a supportive and non-judgmental space. And we want to consider it like a framework to move our groups from. So what we're going to do in this training is I'm not just going to teach you the matrix model by the book. I'm going to show you how to adapt it for real-world clients, especially those with co-occurring disorders at Jade Wellness Center. That means pulling in evidence-based strategies from models like Illness Management and Recovery, or I-IMR, which is specifically designed for clients who are living with both substance use and serious mental illness. I'm going to highlight how to build on strengths, use goal setting and motivational interviewing, teach practical coping skills, and support psychiatric symptom management while also working on recovery. Because most clients don't show up with one neat diagnosis. They show up with trauma, with chaos, with missed meds, and with shame. And it's our job to meet that with structure and flexibility. So let's dig into what the matrix model actually looked like in practice and how you can use it in your IOP or OP groups starting today. So let's first start talking about where the matrix model came from and why it's still one of the most widely used approaches in outpatient treatment, especially when it comes to stimulant use. The matrix model was developed in the 1980s during the height of the cocaine epidemic when traditional treatment models weren't cutting it. Clinicians needed something new, something structured, engaging, and practical, and they needed it fast. So they built a model specifically for people struggling with stimulant use, especially methamphetamine and cocaine. What emerged was a treatment structure that combined the best of what we knew at the time: cognitive behavioral therapy, relapse prevention, psychoeducation, and family involvement. But here's the thing. It wasn't just about the tools. It never is. It's about how the tools are delivered. The matrix model is manualized, but it's not robotic. It's structured, but still supportive. It gives clients a roadmap and counselors a way to hold consistency and accountability in group spaces without shame. So let me break down some of the core concepts here. Groups are going to follow a predictable rhythm or a structured group format. It's going to be check-ins, skill-based discussions, guided worksheets, and wrap-ups. And I think most of you are really already doing a lot of this. The difference here is that there's a curriculum to follow, but room for flexibility. The structure matters. It reduces anxiety, helps clients know what to expect, and builds a sense of safety over time. And instead of focusing on consequences or confrontation, the matrix model reinforces progress. That might mean celebrating abstinence, showing up consistently, or completing homework. Even small wins are acknowledged because early recovery is fragile and motivation comes in waves. Some of the ways that we love to celebrate with our clients are pizza parties or that STARS contingency management program. And then moving on to family involvement. There's a built-in component for family education where loved ones can learn about addiction and the recovery process and how to support somebody without enabling. This helps rebuild trust and break cycles of secrecy or resentment that often follow substance use. And we're going to define family loosely, so not just blood relatives or legal guardians, but anyone in meaningful relationship with the client. That might include partners, close friends, roommates, sponsors, or chosen family. We're not here to draw rigid lines. If somebody plays a significant role in the client's life, they're part of the system that we want to support. And then there's an early recovery focus. The first 16 weeks are critical. The model targets early stage recovery with sessions that emphasize daily structure, avoiding high-risk situations, and creating recovery supportive lifestyle. It's not about fixing everything all at once. It's about building momentum. Regarding urine testing, it's expected, not as punishment, but as a neutral accountability tool. It's baked into the model to help clients self-monitor and stay honest. Therapists are trained to respond non-punitively, using it as an opportunity for support, not shame. And then looking at relapse prevention, it's not just a topic, it's a thread that's going to run through every group. Clients learn how cravings work, how to interrupt old patterns, and how to plan ahead for triggers. And the idea is to teach people how to think, not just what to do. Each session is going to have an educational component, whether it's about the brain and addiction, managing emotions, or dealing with boredom. But it's never just a lecture, it's active learning. Clients are going to write, discuss, role play, reflect, maybe participate in some experiential activities. At the heart of it, Matrix Model is going to draw from three main strategies. Cognitive behavioral is going to challenge distorted thinking and build new behaviors. Motivational interviewing is going to help us meet clients where they are, respecting ambivalence, autonomy, and evoking change talk. And then there's that educational component, teaching real world skills that clients can use outside the group room. So if you've ever struggled to balance structure and freedom in your groups, if you've wanted to offer more than open discussion, but didn't know how to start, if you felt like your groups were just check-ins and there wasn't really a ton of content coming in, the Matrix model can give you a way to do all of these. It offers a spine that you can build around with space to customize, and you can customize to your heart's content. Next, we're going to look at what this model actually looks like in action, what groups are offered, how they're paced, and how to make them work in both IOP and OP settings. So, what does the Matrix model actually look like in practice? Not just one type of group, it's a collection of structured group exercises and experiences, each with its own purpose, format, and rhythm. And when you weave them together, they form a strong, comprehensive treatment experience that touches on the key areas that clients need to stay engaged and build recovery skills. So there's four core types of the matrix model. And again, we're already doing all of this and sometimes doing all four types in one group as is. So that's great work. This walkthrough is just meant to reinforce what we want to make sure we're hitting in JADE groups. So starting with early recovery skills. These groups are designed for clients who are brand new to recovery or just beginning to stabilize. The goal here isn't going to be deep processing, it's building the scaffolding that helps somebody stay clean just one day at a time. And these groups focus on things like understanding cravings, creating a daily structure, identifying internal and external triggers, and beginning to use refusal skills. So think of it as Recovery 101. It's concrete and practical and sets the tone for everything that comes after. Handouts here are short and focused. Many of them use visual metaphors or fill in the blank style content to support folks with cognitive or emotional fatigue in early recovery. And the Matrix model actually has the most content for this next one, relapse prevention. They have 32 sessions in total mapped out just to focus on relapse prevention. It's what they consider the backbone of the program. This kind of group is going to dive deeper into the why and the how of staying sober. So topics here are going to be high-risk situations, negative thinking patterns, boredom and isolation, relationship boundaries, and managing feelings without using. So each of these sessions generally follows a rhythm of review an old concept, teach a new concept, discussion, and wrap up. SAMHSA has a lot of worksheets that you can use here. Things like the trigger thought craving use chain, which really comes a lot from REBT therapy, or coping with urges, which might sound a lot like DBT urge surfing. These worksheets are broken down into simple language, actionable skills, and clear next steps. I have a lot of these resources and I'm going to send them along to you. Um, if you have your own stuff that fits neatly in here, use that too. We're not trying to reinvent the wheel here. And for family education, addiction doesn't just impact the individual, it affects their whole ecosystem. And the groups here are going to be offered to include family members or significant others. Topics here are going to include the science of addiction, enabling versus supporting, communication skills, setting healthy boundaries, and how to navigate early recovery together. The tone here is compassionate but firm. And families are often confused, scared, and burnt out. This is a space where they can learn without blame and start seeing their loved ones' recovery through a new lens. So I have a lot of supplemental materials for this if you're looking for something to include in a family group, especially for explaining things like brain chemistry or how recovery timelines might differ from family expectations. And the fourth style of group in the matrix model is that social support. It's designed to help clients build sober connections and maintain recovery long term. It's kind of like a hybrid between group therapy and mutual aid. Here, there's not necessarily a new lesson every week. Instead, clients review what they're applying from other groups and support each other in real time. So a lot of time our OP groups just generally naturally always look like this. But what's covered in these groups are going to be practicing emotional honesty, building trust, giving and receiving feedback, and staying accountable. This is where the work really gets relational. Less structured than the IOP groups, but still needs a facilitator who holds boundaries, redirects when needed, and models secure, compassionate presence. And we want to make sure that we're really calling out the work that's happening in these groups. Focus on, wow, you're doing such great work being emotionally honest or building trust with each other, giving and receiving feedback. We want to make sure that we're naming it so clients can recognize the skills that they're building. And across all group types, the matrix model is handout heavy by design. It's not meant to be filler, it's meant to be a trauma-informed and neuro-informed choice. Why? Because in early recovery, Attention span, memory, and executive functioning are often compromised. So the worksheets break concepts into digestible pieces, offer visual reinforcement, give clients something to take home and review, and serve as a starting point for real conversation. So you can definitely use your own materials or adapt them from multiple sources, like combining matrix model tools with IMR strategies. Just we want to be consistent. So you can keep a shared folder or a binder. I know we have lots of resources available to you. I'm going to encourage you to also use a visual tracker like a group progress checklist. So you can celebrate worksheet completion as a way to mark effort and investment for your clients. But you're also going to want to track what topics you're covering and when so that you know when it's time to circle back to them. Up next, we're going to talk about how to actually run one of these groups, what your role looks like, and how to hold space with structure and with heart. So let's shift from the what the matrix model includes to how you actually run it. Group facilitation isn't about just showing up and keeping people talking. It's about creating an experience that balances structure with flexibility, information with connection, and accountability with compassion. So, what makes the matrix model different? In most group therapy approaches, facilitators are trained to take a non directive, process oriented role. So, think we're going to go where the group needs to go. And it's not exactly how the matrix model works. In the matrix model, you're not just the facilitator, you're expected to be a coach and a teacher. Your role is active. You want to guide the group with intention. You introduce new material, you interrupt when needed, you hold structure so that clients can focus on learning and building recovery skills without the group derailing. But that doesn't mean that you're lecturing from a podium. You're still using all the best group skills that you know: reflective listening, encouraging participation, normalizing experiences, linking one client to another, and fostering safety. And the difference is that you're doing it all within a structured framework. So at Jade, we use the matrix model as a foundation, not necessarily a script or a manualized approach. We know that our clients need structure, but we also know that recovery isn't linear. That's why we don't follow the manual word for word. We don't expect you to go in the exact order or read from a book or necessarily use all of the worksheets as is. What we do instead is we're going to give you topic checklists to help you track what's been covered. We're going to make sure that each client gets exposed to the core content of early recovery, relapse prevention, triggers, coping, lifestyle change, even if the order shifts around. We encourage you to adapt your sessions based on what the group needs that day. So if somebody's just spinning out because they almost relapsed last night, you're not going to force a topic on the science of dopamine. You're going to meet them where they are. Maybe we're going to start talking about some relapse prevention, some shame, some guilt, the cycle of addiction. And then maybe the next day we circle back to that dopamine lesson because now it might actually land. But we always want to make sure that we're checking in with the group, asking them what they need, what they want to focus on. We're also going to listen to that meta story in the check-in process, and we'll talk about that a little bit later. We're going to focus a lot on the core or common themes that people are bringing up over and over, because that's what we're really going to want to focus on. That's what's relevant in the moment. So regarding holding the group frame, facilitating a matrix style group means holding a tight frame without becoming rigid. You open the group with a check in, offer a topic, walk through a handout or concept, and hold space for discussion while keeping an eye on time, tone, and direction. You don't let things spiral. And this also means avoiding war stories. These are the detailed, using stories that glamorize the past and often end with laughter or approval from the group. They can reinforce cravings or distract from the work. If a client starts to drift into that kind of sharing, redirect gently but firmly. You could say something like, hey, let's focus on what happened before and after the use. What triggered it and what helped you get back on track? We also want to look at using drug testing as neutral accountability. Testing's part of the model, but it's never used to shame. It's never used to punish. If somebody tests positive, respond with curiosity and support, not punishment. You can ask them, what do you need to get back on track? We don't want to ask them, why'd you mess up? And matrix groups aren't just talk it out spaces. They're goal oriented. You should be checking in regularly about what your clients are working on, whether it's building a sober routine, reconnecting with their family, or reducing triggers. So even small goals count. Did you go to that meeting that you planned? Were you able to walk away from that argument? Did you use the urge surfing worksheet when things got really tough? Progress isn't always linear, but if you're not checking for it, clients might not see their own growth, and that matters more than we realize. So matrix groups need you to be steady, consistent, and real. You're not a blank slate, you're a warm, structured guide. You're teaching people how to show up in their lives differently, and that all starts with how you show up in the group room. So let's be honest, most of the clients that we serve aren't coming in with just a substance use disorder. They're also living with depression, anxiety, bipolar disorder, trauma, psychosis, or a combination. So if we're only focusing on abstinence or cravings, we're missing the bigger picture. And that's where illness management and recovery, or I-IMR, comes in. It's an evidence-based practice built specifically for people living with co-occurring mental health and substance use disorders. It's strength-based, collaborative, and goal-focused, just like the matrix model. And the beauty of it is that you don't have to choose one over the other, you can blend them. In real-world treatment, clients just don't show up in neat diagnostic boxes. You're not running one group for addiction only and another just for mental health. It all shows up in the same room at the same time. And clients don't know how to tell the difference between the two either. They're just themselves. And that's where we need to take a more holistic approach and make sure that we're doing co occurring treatment. So we need tools that acknowledge the mess and offer practical steps forward. By integrating I-IMR principles into matrix style groups, you can normalize mental illness as a part of the recovery conversation, support medication adherence without stigma, create space for both emotional processing and skill building, and help clients connect their mental health symptoms to their substance use triggers and their substance use to their mental health symptoms. Because we know that unmanaged mental health symptoms often lead to relapse, and untreated substance use makes it harder to stabilize mental health, and we just can't separate them, and neither can our clients. So here are a few I-IMR techniques that plug right into the matrix style groups. Goal tracking. Clients are going to set small, specific goals related to both substance use and mental health. So an example could be take my medication every morning, or practice one coping skill after work instead of smoking, or attend my therapy session even if I feel anxious. Put them in their treatment plan, revisit them weekly, encourage peer support, celebrate progress. Also going to use motivational interviewing. Many clients feel ambivalent about treatment, especially psychiatric meds. We can use MI to help explore. What are the pros and cons of staying on your meds? What do you hope will be different if you stay engaged in treatment for the next month? We also want to look at cognitive restructuring. Clients can learn to identify distorted thoughts and challenge them. This overlaps beautifully with matrix relapse prevention handouts. You can adapt worksheets to include both substance-related triggers and mood-related triggers. And one strength of I-IMR is that it covers multiple areas of functioning, which you can build into your group topics depending on who's in the room. So some examples could be stress vulnerability model, and that's how stress impacts symptoms and how to reduce it. Medication management, why meds are used, how they work, and what to expect. Social support, identifying healthy versus unhealthy support systems, which may or may not be blood relatives. Relapse prevention, framed around both substance use and mental health relapse. And coping with symptoms, recognizing early warning signs and taking action. And you're still going to hold that recovery frame, that ground in substance use treatment. You're just expanding it to include the whole person. And the I-IMR manual that I'm sending you also includes some clear, simple worksheets and handouts that you can bring directly into your group, including symptom tracking tools, wellness goal planners, role play scripts for medication refusal or peer pressure, and coping skill menus. These pair really well with the matrix worksheet. You can use one or the other, or you can use the worksheets that you've already been using if they support these topics. And sometimes clients need more than just the group space to manage co-occurring issues. That's where the individual sessions come in, especially if a client is struggling with hallucinations, paranoia, severe anxiety, or medication issues that don't fit the group format. So we're going to use those one-on-one sessions to rehearse skills that they're learning in group, adjust goals, problem solve barriers to participation, and offer deeper psychoeducation or crisis support. And then we're going to loop it back into the group the next week so clients feel like they're part of a bigger whole. So if you're working with a mixed diagnosis population, which most of us are, Matrix gives you structure and the I-IMR gives you depth. Together, they're going to help you meet clients where they are while still moving them forward with clarity and intention. You don't have to be a psychiatrist to talk about medication, but you do have to be a psychiatrist to prescribe, to talk about dosing, to make recommendations about what kind of medication. You don't have to be a trauma specialist to acknowledge emotional pain. You just have to be willing to use the tools and trust that your clients can learn to manage both recovery and mental health one step at a time. So let's zoom in for a minute. You've got your matrix handouts. You've got a group of 6 to 8 clients in early recovery. You've got a 3-hour block to fill for IOP. What does a matrix-informed group session actually look like? Here's a breakdown of how you might structure your time. And honestly, it already looks a lot like the format that we're generally using for IOPs anyway. With our opening, we're going to start with a brief welcome and check-in. You're setting the tone, reminding folks of group guidelines, and doing a quick emotional temperature check. Maybe you're doing some light housekeeping here too of like, hey, you need to give a urine, you need to schedule an individual. Some therapists might use a number scale. What's your mood today on a scale of 1 to 10? Others could ask, what's one word that describes where you're at right now? And this isn't small talk. It's going to help clients transition into the room and into the space of group. And it also is going to help you spot who might need extra support during or after the group. And then we're going to do maybe more of a longer format check-in. This part's essential, especially in early recovery, because the client's going to get the opportunity to share about their sobriety status, their cravings or triggers since last group, wins or challenges, and whether they completed any homework. And as a therapist, you're tracking themes here. You're not just listening, you're noticing what's showing up in the group as a whole, the theme or the meta story. If 3 people are talking about boredom, that's probably where you're going to want to focus your topic discussion on today. This is where you're going to reinforce abstinence, redirect euphoric recall, and offer short reframes. You want to keep it focused and respectful. You want to link clients to each other, but also limit crosstalk unless it's supportive and on topic. Next up is the topic or skill based segment. You're going to introduce the topic of the day, and it might be understanding the craving cycle, coping with difficult emotions, identifying early warning signs of relapse, healthy communication and relationships. You can use a handout or a visual aid here and walk through it with a group. Read out loud, ask reflective questions, make it a space for clients to apply the concept to their own experience. If you can do an experiential activity, even better. This is a teaching moment, but it's also going to be interactive. You're not lecturing, you're using the material as a launch pad for discussion. If you're incorporating I-IMR, this might also be where you introduce a mental health topic, like managing symptoms, staying on medications, or reducing stress. And then there's a group discussion. Open up the floor for client responses. This is where the group's going to come alive. You can ask them questions like, what stood out to you today? How would you apply this next time if you felt triggered? Or what's hard about what we just talked about? Let clients share, reflect, and connect, but keep the discussion grounded in the skill or topic. It's easy for people to drift into stories or side conversations or just these long, drawn out tangents. You can bring them back with questions like, hey, how does that relate to the skill that we're practicing today? And then to close the group, you're just going to summarize the main takeaway, assign some short, clear homework task. And it's not homework for the sake of homework, but it's homework if it's going to be meaningful to your group. We want to check in on next steps or upcoming appointments. And maybe you're going to check out with a really quick round robin. Hey, what's one thing that you're taking from today? You can also preview tomorrow's topic if you have it planned already so that your clients know what to expect. So a session like this is going to give clients consistency, clear expectations, and space to reflect and apply. It's also going to offer multiple entry points for participation, no matter how they're feeling that day. So let's talk about some of the real world challenges that come up when you're facilitating matrix model groups and what to actually do about them. We're going to start with stages of change. Here's the thing. If you're using an intervention that doesn't match where your client is at in their readiness for change, it's not going to land. It doesn't matter how polished your presentation is or how great your worksheet is. If you're offering relapse prevention strategies to somebody who's still in pre-contemplation and doesn't think that they have a problem, you're missing the moment. And that mismatch isn't just ineffective, it can actually shut the client down. So before jumping into psychoeducation or goal setting, check their stage first. In pre-contemplation, the client doesn't see their behavior as problematic. Your job here is gentle exploration. Use reflective listening, curiosity, and help them hear themselves. In contemplation stage, they're ambivalent. We want to normalize that. Help them weigh pros and cons. Double-sided reflections and values work go a really long way here. In preparation, we can start to talk about planning and small behavior changes. And in action and maintenance, this is where relapse prevention, coping skills, and structured planning really click. And resistance isn't a problem. It's a signal that you've stepped too far ahead of where your client is. When clients push back or check out, you want to slow down, roll with the resistance, circle back to what matters to them. If the group energy is really low, try anchoring the conversation in client language, what they said they want, because that's always going to be your leverage point. We want to make sure that we're asking them what they need. And in any group, you're going to have a mix of different levels of motivation. Some folks are ready to change. Some are just there because the judge said so, and that's okay. The matrix model actually expects this. Meet each person where they're at and don't shame them for not being motivated enough. Use affirmations and reflective listening to keep everyone engaged. And maybe the celebration for the day is just that they showed up. That's awesome. Tomorrow, let's make sure they show up on time. And if somebody's disengaged, don't call them out in a way that puts them on the spot. Instead, you want to invite them in. Hey, I noticed you are quiet. What's going through your mind as we talk about this? That approach respects autonomy and builds trust. Punishment doesn't work for internal motivation building, but compassionate accountability does. We also want to adapt for trauma or serious mental illness. Be mindful. Clients with trauma histories or co-occurring disorders might need more flexibility. If somebody gets overwhelmed, it's okay to take a pause, check in with them, reset. You're not just teaching content, you're co-creating safety. The bottom line here is that behavior change isn't linear, but your clinical intuition gets stronger when you start syncing your interventions to the stage of change that your client is in. That's when the matrix model really starts working, not as a curriculum, but as a relational tool. So as we wrap up today, here's the big takeaway. Matrix model gives you a solid structure, but it doesn't mean that you have to follow it like a script. You don't need to run group like a robot. You don't need to stick to page 27 just because it's Tuesday. But what we do all need is structure and flexibility with a clear map that still lets you take detours when your group needs it. Consistency is going to be key here. When the clients know what to expect, how the group opens, how you introduce a topic, how you hold space, they feel safer. That consistency builds trust and also helps you stay grounded when the room gets chaotic or heavy. So at Jade, we want to make sure that all groups, no matter the site or the therapist, are covering the same core topics. The what needs to stay consistent so that every client has access to the same foundation. But the how is yours. It's up to you. Bring your it factor, your secret sauce. You're the tool, and the relationship that you build with clients is part of what makes the group healing. Just make sure that the content gets covered. Structure creates safety, and consistency across sites creates fairness. So, how do you start using the matrix informed approaches right away? You don't have to overhaul your whole program or the way that you run group. Most of this you're already doing. So, we want to start small. Try a different handout this week, or try structuring your group using the check in, topic, discussion, wrap up flow. You can begin tracking which topics you've covered using a checklist so that you can spot gaps and avoid repeating content. And remember, blending works. If you've got IMR worksheets, seeking safety topics, or your own group resources, DBT, Gestalt, or therapy, great. Use what fits, use what works for you, use what you're trained in. We're not asking you to change the way that you are with clients. We just want to see this as a structure to make sure that across all groups and locations, the clients are getting the same opportunities to focus on topics. The point isn't to be loyal to one brand of therapy. The point is to deliver evidence-based, client-responsive care in a way that's real, useful, and doable. And at the end of the day, the best group is one that helps people feel seen, learn something, and leave with a little bit more hope and a little more skill than the way that they walked in. You can do this. Remember, it's one group at a time.